the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.
Wow, I really get into my theme music when it starts. I don't know. If you like it, put it in the comments. But if you don't like it, you don't have to tell me because I still enjoy it. Hey, welcome to UroNurse. I'm your host, Vic Senese. Welcome to the show. Glad to have all of you that are willing to get up on a Saturday morning, join me live. And the rest of you, well, we'll see you later, right? Hey, if you're watching, be sure to like and subscribe. That's how we get you guys to know about the show every week. Always check out our website at UroNurse.com, like it says on the bottom there, because that's where you can find out more information about the show. Hey, we got a really great show for you today. I'm going to go ahead, though, and bring in my co-host with me, Lori. Lori, welcome to the show. How are you doing
today? Good morning. Good morning. I'm doing great today. How's everybody else?
Good, good. We were just talking about the smoke that's been in the air lately, and we've had it's at least finally cleared up today, so it's going to be a nicer day, I think, without all that smoke in the way.
Yep.
That's them Canadians. They got to do something about that.
Yeah.
You're listening from Canada. Work on those forest fires, would you? All right. Well, today I was telling you I got a great show. You know, I was talking about artificial intelligence is rapidly changing healthcare, not by replacing us nurses, but by helping us, right? Becoming even better educators, communicators, and advocates for our patients. Now, one of the most exciting AI tools that come along today that I'm just crazy about is this thing called NotebookLM. It's developed by Google, and it's actually, they just changed it to Gemini, I think, Gemini Notebook, just before I started the show today. Unlike many AI systems that search the internet for answers, Notebook works from your own trusted sources. That's key. You upload clinical guidelines, educational materials, maybe you already have in your office, journal articles, your organization's protocols, and the AI generates summaries, frequently asked questions, study guides, timelines, even podcast-style audio discussions based solely on these documents. Or you can even ask it to do the research for you, and it'll bring up the articles. It's using research, not just creating stuff like AI sometimes can wander off. So all I can say is get ready to have your mind blown, because I'm going to go and take you on a journey you'll never forget. Here we go. Here we sort of go. All right. So the program I use is something called NotebookLM. It's from Google, and it's a free program. You can use it yourself. This is going to be mind-blowing. If you're using it for the first time, you'll be on an untitled notebook, or you can, if you've got a previous one here, like I've got a lot of them, you can click this create notebook up here to start a new notebook. But all right, so let's go ahead and just start it like that, because it'll bring up here what we want to search now, or what we want to create. So what I'm going to do is give a brief description of what we're planning. So I'm going to be creating patient education for a presentation I'm giving on UroPatient on radical cystectomy and what patient supposed to expect after. So we can type that in. Okay, of course I can't spell instructions correctly, can I? All right, so patient instructions on life after radical cystectomy for bladder cancer. And we can do fast research, great for quick results, or deep research for in-depth report and results. Now, if I was doing this for medical professionals, I would probably do the deep research. The fast one, I think, is going to be fine for this. I'm not looking for a lot of deep research. But now what it's doing is it's going through and it's using websites, Google, surprised. But if you were doing a project like this, chances are you're going to use Google to find the information. Now, here's what's kind of cool. So it's brought up a couple of different things here, and it says 7 more sources. So I'm going to go ahead and click right there to load up 7 different sources. Now, it automatically selects all these sources. What it's going to do is read through and produce whatever I want it to produce, and I'll have to put that down here where it says start typing. But here's the thing is, Let's see what they're exactly pulling up as research. So here's radical cystectomy postoperative instructions, the Urology Institute. If I want to look at that, I can click this arrow above, and it's going to bring me right to that website and that article. And this is kind of neat. So the Urology Institute put together a pretty nice breakdown of what you need to do. And you look at it, see if it's something that looks pretty good. This is actually would be nice for patient education. They did a great job. Now, I didn't have to go do all that searching on Google to find that. It found it. Life after bladder removal. Blech. Navigating the new normal. Outcomes for me. Let's see what that's about. So you can see radical cystectomy, surgical removal of the bladder, one of the standard treatments for muscle invasive bladder cancer. Life after bladder removal is undeniably different. So it's kind of explaining. Look at this. The first 30 days, what to expect when you get home. So that's kind of neat. I like that. Evidence-based powered NCCN guidelines. Managing your diversion, neobladder versus urostomy. We know that there's different things that are done, neobladder versus ileoconduit type, have different things, but they do explain both. I'm pretty happy with this outcomes for me site, so that looks good too. Then we go back to our site. Urination schedule for your neobladder. I'm going to probably do 2 talks, one on neobladder and one on ileoconduit. So for right now, I'm going to unselect that because I'm really not going to, I don't want a lot on neobladder. Continent urinary diversions. Again, that's kind of more the neobladder, so we're going to get rid of that. Radical cystectomy. Let's take a look at that one. Oh, that's actually a PDF that they put out. Patient family information sheet. What is a radical cystectomy? Wow, I like some of these drawings here. How do I care for myself afterwards? So yeah, I'm good with that. That's a nice looking article. I'll leave that one checked. Diet after cystectomy. Let's take a quick peek at that. Now, you notice what I'm not doing. I'm not just taking and putting these things in here blindly. Read the information. It's up to you. You're the professional. Diet after cystectomy. I'm not so sure that this is kind of a what they call a blog. So I'm not so sure I want that. So I'm going to get that out of there. Oops, that was not the one I wanted. That's the one I wanted to get out. Navigating relationships and intimacy with bladder cancer. I'm curious what that's going to be. YouTube, guest speaker from a sexology intern. Yeah, maybe I don't think that's kind of really what I want though for my talk, so I'm going to take that out. Psychosocial distress and quality of life in patients after radical cystectomy. And that's the National Library of Medicine. So this is an article where they did some research on 842 German patients. And again, I recommend you read through all this and see if this is really what you're looking for. Yeah, sounds like this is a pretty interesting article. I'm going to keep that one in there. And find support BCAN. We know what the BCAN is, that Bladder Cancer Advocacy Network. Resources for bladder cancer survivor, a lot of so I'm going to let them go ahead and read through all that for me. So if it looks like it's something that's going to make sense, then I'm going to go over here and import those. So now it's doing, so it just showed me what the research was, but it didn't read through the research and didn't start creating my talk. Now it did. So radical cystectomy and urinary diversion postoperative care guide. So it started to create that. So now this is the research, and there's some other stuff if I wanted to look at things like I can add stuff to it, but I'm pretty happy with what it's showing me right now. This is kind of what I'm interested. So, you can read through this with me if you want. The sources: a comprehensive guide of radical cystectomy, major talks about what it's used for, importance of wound care, monitoring for infection. Does talk a little bit about the neobladder, but again, I was trying to not cover too much about that. So now we want to create a slide deck that I can actually present to patients on my show on UroPatient. So I'm going to create a 15-minute slideshow on and I don't know that you have to put that title in there, but aimed at patients. I'm going to take that out. I don't really want to have that. Create a 15-minute slideshow on radical cystectomy, blah, blah, blah. Okay, so on that. Now I'm going to ask it to do a little bit further deep. Your prompt is your whole thing. So I'm going to ask it to make it photorealistic. Otherwise, it's going to give you a lot of kind of comic book looking stuff. Photorealistic slides include information on post-op recovery, care, stoma care, and resources. So we'll see what that gives us, okay? Now I'm going to copy this right here because I do this two ways. So I'm going to go ahead and click this. It's probably going to start making a slide deck, but I'll go ahead and ask it specifically to make a slide deck just in case it doesn't. It may just be doing research. Whoops, that's not what I wanted. I wanted this. Copy. Oh, it is generating a slide deck for me. Usually it will. If it doesn't, you can go in here. A detail deck versus presenter. Detail will have a lot more information on it. You know, it won't be as many just pictures. Presenter slides should be more presenting type deal. So let's go ahead. They probably give us two different types that way. We'll generate that too. Now, word of warning, this takes time. If we were to sit here and watch these things cranking away, we'd be spending a lot of time. But we're not going to keep you on that. Now, here's the other thing that's interesting is besides what we're creating, which is going to be a slide deck that I can present, there's another type of information that you may want to have. Maybe for your group, you want to have a video that patients could watch right, before they have surgery. You could have it on your website. So this other one called Video Overview is the same thing. It could be cinematic, which I kind of like, explainer, or short. We'll probably try a few of them just to see. What should it focus on? Yeah, that, and that. I like that. I'm going to ask it to make it photorealistic. And we're going to do a cinematic. Let's see, I'm just going to copy that again. So we're going to ask it. We'll generate that. And then we're going to go in here and let's do a explainer video. And we can kind of see what this sort of looks like. It'll give you different options if you wanted to kind of have an animation or paper craft or heritage or watercolor. I'm kind of interested to see what the we'll do all the same things. We're not going to do photorealistic because we're asking it to make it watercolor. So let's generate that. And then finally, this new one. I never tried this before. Short. Well, I guess it's going to cut down a piece of it. So just well, let's see what this does. Now, for this one, I am going to ask it to make it photorealistic. Let's see what we get. So my experience has shown me this is generally going to take about 10 minutes. So I'm going to go ahead and pause the video and come back. All right. So that's what it was doing to go ahead and produce those things. And I'm going to show you what it came up with, because I think seeing the actual slides and these videos are what's going to really blow you away. Seem pretty, Lori, you haven't seen this before. Does it seem pretty straightforward on how to use it?
For someone, as you know, who is technically challenged, so far it's good. It's really good. I can't wait to see the outcome.
The key thing in that one box that was off to the right, you can bring up all sorts of different options. You can make films, you can make slides, you can make all sorts of things that I haven't even tried. That one that was new, I'm not going to show you. It created what would be used if you were doing a Facebook reel. It's one of those vertical videos, the long way instead of, I mean, the up and down instead of like a phone. So if you wanted to put something on a phone, but I didn't bring that one up for the show. So now here's the slide deck it created. This is the photorealistic slide deck that I can go ahead and use as a presentation. Hang on, here we go. Let me bring you back in here. So here you can see this is the first slide that it produced. You're kind of nicely labeled, and I said photorealistic. It's got a looking like a patient. Understanding your surgeries, little bullet points in there. And what do you think of that image? I mean, that's really, to try to go and hunt and find these kind of images, that's pretty tough. And I like how it spaced it. That's nice. Talks about the new plumbing, the two diversions, a neobladder versus an ileoconduit. And I'm going to be giving those talks on Uro patients. So if you're interested, watch, because they're coming in the future. But I did break it into two. The recovery roadmap, I think, breaks it into phase one, the early 0 to 2 weeks, 2 to 6 weeks, 6 to 12 weeks. Again, you want to read through the slides, but remember, this was all based on the research that we already read. So you're not getting an AI kind of imagining what it thinks you want. It's really putting what I did research on. The first 30 days at home. Again, I love that picture. That looks like somebody's recovery, right? This one, anatomy of a healthy stoma. That's really important teaching. Let them know what it is, how it should look, what's normal. I think that's a really neat looking photorealistic image. Pouch change rhythm. The patients have a lot of questions on what they need to do. So it goes through, prep, removing it, cleaning, drying, applying. How many times have you struggled teaching patients how to put on a pouch, huh, Lori? It's just one of those.
Well, luckily, I haven't gotten into that too much.
Oh, you haven't? I had several of the patients that had the old traditional radical cystectomy with the ileoconduits, so did a lot of that. Here's a set of rules to go over with patients. The nighttime connection, bedtime setup versus the morning disconnect, because these things can produce a lot of urine. You can have it at night drain into a bag so that you're not overstretching your bag, or worse yet, leaking. Skin protection is huge. That's the whole key. Urine's not the best thing to have on skin. So it kind of goes through some of these products. It pulled in those pictures of stoma adhesives. I didn't have to look for it. Reclaiming intimacy, important. And I think that's a nice picture to kind of demonstrate that. And again, these pictures just blow me away. If you ever created a slideshow to give a presentation and had to go and dig up all these slides and pay probably someone to produce these, or a company to use their stuff that they've got, it's expensive. Symptom checker, they use the red light, green light, yellow light. That's what's normal, what you need to start worrying about, and what you better go to the emergency room for. That's big for patients. A support ecosystem, because it did kind of look into that, who you talk to, outcomes for me app. Stepping into your new normal. Nice approach on that picture, stepping. And basically that's what it came up with for slides. Now, as I mentioned, I could utilize this as a slide presentation to patients that are new to the getting an ileoconduit, but I'm going to show you a video that it'll actually produce that you could actually have on your company's website so that somebody had to look for an educational video or wanted an educational video. Same research. I just told it to make a realistic video, and hang on, here we go.
Looking at this schematic of the human urinary tract, we can see a perfectly automated biological plumbing system. The kidneys are constantly filtering waste out of the blood, sending a continuous downward flow of urine through these connecting tubes, the ureters, and into the bladder. That bladder acts as an expanding, automated storage tank. It is wired with specialized nerve endings that autonomously signal your brain the exact moment it reaches capacity and needs to be emptied. But when cancer or severe disease threatens the body, the most effective solution is often a radical cystectomy. This is a major surgical procedure that entirely removes the bladder, along with its surrounding tissues. You can see the immediate anatomical crisis this creates. The kidneys don't stop. They continue producing urine, but the body suddenly has no storage tank to hold it and no connected exit route to release it. Waking up in the intensive care unit with this disrupted anatomy is disorienting. In those early days, you rely entirely on a temporary network of external drains, tubes, and catheters just to safely process fluids. Surviving this procedure means learning to replace a natural organ that worked on autopilot with a newly engineered, manually operated system. To restore the flow of urine, surgeons have to build a detour. The most common option is called an ileal conduit, which utilizes a small, isolated section of your own small bowel. This diagram shows the reroute. Surgeons attach severed ureters to a bowel segment, pulling it through the abdominal wall to create a stoma. It has no feeling, so touching causes no pain. A healed stoma becomes moist and pink. Because this system constantly drains urine outward, it requires external hardware. You wear a specialized collection pouch that attaches securely to your abdomen using a protective skin barrier called a flange. Protecting the skin around that stoma comes down to a strict mathematical rule. As this visualization shows, the center hole of the flange must be cut exactly 3 millimeters, or 1/8 of an inch, larger than the stoma itself. Any tighter and you risk choking the tissue. Any looser and acidic urine will leak and severely irritate the skin. Operating this system becomes a new daily routine. It involves manually draining the pouch using a swivel tap throughout the day, and then connecting that pouch to a larger capacity drainage jug to get through the night. Choosing an ileal conduit means accepting a new, permanent responsibility. You are now the active, external manager of your own continuous waste stream. For some patients, there is an alternative, internal reroute option called a neobladder. This schematic shows folding an intestinal segment into a spherical internal reservoir. Because this hardware is constructed from intestinal tissue, it has a critical flaw. It lacks the nerve endings of a natural bladder. It never signals your brain when full. To compensate, you have to adopt a mandate of timed voiding. You must train yourself to urinate on a strict, conscious schedule, which is usually every 2 to 3 hours during the day, and by setting alarms to wake you up repeatedly through the night. It also requires intense physical compensation. Patients must commit to ongoing pelvic floor therapy to manually strengthen the surrounding muscles, creating the control necessary to prevent leakage. While a neobladder successfully hides the hardware inside the body, it demands relentless mental focus and physical training to perfectly replicate a process your nervous system used to handle effortlessly. The first 30 days back at home present a steep physical climb. Energy returns in frustratingly uneven waves, and with your appetite often lacking, you have to prioritize small, protein-rich meals to give your tissue the building blocks it needs to heal. You also have to protect your newly engineered core. That means engaging in gentle, frequent walking to get your blood moving, while strictly avoiding lifting anything heavier than 5 pounds for several weeks. During this window, you need to watch for absolute medical red flags. If you spike a fever over 101 degrees Fahrenheit, or 38 degrees Celsius, or if your stoma suddenly turns purple or black, you need immediate medical triage. The same urgency applies to mechanical failures. Head to an emergency room if you experience a sudden halt in urine drainage, or if you see bright red blood that refuses to stop after 15 solid minutes of applying pressure. In this critical period, the difference between a successful recovery and a surgical emergency rests entirely on your daily vigilance and your ability to spot these failures as they happen. Even as the immediate recovery ends, long-term survival remains an active, ongoing process. That means strictly maintaining every single follow-up imaging appointment and pushing your medical team for advanced biomarker or genetic testing of the original tumor to map out potential future treatments. It also helps to integrate into peer support networks. These communities are where you learn the unspoken, everyday operational tricks from people who have successfully navigated the exact same anatomical changes. Mastering these mechanical requirements is what provides the predictability you need to move forward. When the pouch changes and the voiding schedules become automatic, you have successfully replaced a biological function with a managed one.
What did you think of that
Wow.
video?
That was incredible.
Same
Of course,
research.
avoid the person with the creepy eyes, but
Yeah, it's got to give AI a little leeway on it.
yeah, that's amazing.
But I mean, and that was the photorealistic one. I'm going to show you the more cartoon, and I think some of these you see if you watch YouTube. There's a lot of them being made now through AI, where kind of does a cartoony sketching thing. So it'll do all that. So now this was all done by the same research, by just telling it to create slideshows versus creating the movies. So
Wow.
it just blows me
And
away. So
quick.
here's the one where I said use a watercolor. So I picked watercolor out of that group of things it gave me.
Welcome to this explainer. Today we're unpacking the journey of life after a radical cystectomy. If you or a loved one are facing the surgical removal of the bladder, the road ahead can honestly feel pretty overwhelming. But today we're going to demystify this postoperative journey step by step. By looking directly at clinical guidance and patient resources, we're going to show you exactly how navigating your new normal can and will lead to a full, active, and really meaningful life.
It's a massive question, isn't it? I mean, waking up from this major surgery with new tubes, drains, and a completely new way your body functions is deeply disorienting. Acknowledging that profound physical and emotional shift is really the very first step toward regaining control. Your body just works in a new way now, and your routines will have to shift. But this isn't about accepting less. It's about understanding what your body needs right now, so you can fully reclaim your health.
To help reduce the fear of the unknown, we've structured a clear roadmap for us today. We'll cover immediate recovery, understanding your urinary diversion, daily care and maintenance, reclaiming your lifestyle, and finally, long-term survivorship. So, let's jump right in.
Section 1. The immediate recovery, your first 30 days. Let's look at the immediate aftermath as you transition from that initial 7 to 10-day hospital stay back to your own home. Okay, so pacing yourself here is absolutely everything. Your physical recovery happens in highly manageable, distinct phases. In those first 2 weeks, significant fatigue is entirely normal, and honestly, your appetite might lag a bit. But gentle walking is crucial. It prevents dangerous blood clots and wakes up your digestion. Then, from weeks 2 to 6, you're going to gradually increase your walking distance, but you must avoid lifting anything over 2 to 3 kilograms. Your core just needs time to heal. It really isn't until weeks 6 to 12 that you slowly return to normal. But keep in mind, heavy lifting remains completely off the table for a full 3 months.
Now, while you heal, you need to be the primary monitor of your own body. Keep a daily log of your symptoms, your temperature, your pain levels, and your output. You need to contact your care team immediately if you experience any of these stark red flags. A fever above 101 degrees Fahrenheit or 38 degrees Celsius can indicate an infection that might escalate quickly. Likewise, if your stoma just stops producing output or you feel severe leg swelling, which could actually signal a blood clot, do not wait. Seek urgent medical attention.
Moving on to Section 2, understanding your urinary diversion, the new plumbing, because once you're home, this dictates almost everything about your daily routine.
You're typically looking at one of two main paths here. If you have a neobladder, your surgeon constructed an internal reservoir right from a segment of your intestine, but because it lacks the nerve signals of a natural bladder, it won't actually tell you when it's full. So you have to train your body to void on a really strict schedule, typically every 2 to 3 hours, and engage in pelvic floor training to avoid incontinence. On the flip side, a urostomy, or ileoconduit, drains urine continuously through a stoma into an external pouch, and that requires mastering external pouch management and some pretty meticulous skincare.
If you have a urostomy, you'll have a stoma. Let's demystify what this actually is. A stoma is just a piece of your small bowel attached to your abdomen. When you first look at it in the hospital, it might look dark, swollen, or bruised. Do not panic. This is totally temporary. Within a few days, it heals into its normal, healthy state.
which is soft, moist, and pink or red. Now, it's really important to know that the stoma has 0 nerve endings, so you won't feel it when you touch it. But the tissue is delicate, meaning it can bleed a bit if you rub it too vigorously.
Section 3. Daily Care and Maintenance, your practical manual. Let's get right into the literal step-by-step instructions for managing your urostomy pouch so you can build some real confidence.
Emptying your pouch might seem a little intimidating at first, but it breaks down into a highly achievable 4-step process. First, you can either sit or stand at the toilet. Uncap the pouch, aim it, and turn the swivel tap until the indicator shows it's open. Just let it drain completely, then close the tap, wipe it with a bit of toilet paper, and recap. Honestly, do this a few times throughout the day, and very quickly, this routine will just become total second nature to you. Now, changing the entire system, the pouch and the flange that sticks to your skin, requires a regular schedule to prevent leakage and painful skin irritation. The absolute maximum wear time is 7 days. When you change it, always empty the pouch first. As you pull the flange away, hold your skin down gently to avoid any tearing. Wash the skin with plain water and pat it dry. Remember, do not rub. And here is a huge non-negotiable rule. Absolutely never insert anything, like gauze or toilet paper, into the stoma itself. Okay, here's a really practical insider tip right from the clinical guidelines. If you have hair on the skin around your stoma, removing it gives the flange a much better seal and cuts down on irritation. But you want to use an electric razor, not a traditional blade. To protect that delicate stoma while you shave, you can literally just place an empty toilet paper roll or a plastic cup directly over it. It's a super simple, safe hack that makes a world of difference for your comfort.
Getting the fit right is a completely crucial point. When you're prepping a new flange, you'll trace your stoma pattern onto the back of it and cut a hole. That hole needs to be exactly 3 millimeters, or 1/8 of an inch, larger than your stoma. If the hole is too big, your skin gets exposed to urine and gets irritated. If it's too small, it can actually pinch and damage the stoma. Taking a few extra seconds to get this measurement exactly right is your best defense against skin breakdown.
Which brings us to Section 4, Reclaiming Your Lifestyle, from Surviving to Thriving. With the practical manual down, it's time to transition our focus to getting back to the life you love.
Listen, your new normal absolutely does not mean accepting less. Yes, you have to let your core heal in those first few months. But as you rebuild your strength, the data clearly shows that structured physical rehabilitation greatly improves your outcome. You will absolutely be able to get back out there, whether that's gardening, biking, hiking, or whatever active hobbies bring you joy. Thriving also just means making a few simple lifestyle tweaks. Eating smaller, protein-rich meals really helps your energy levels. Hydration is massive here. Drinking 2 to 3 liters of fluid daily prevents urinary tract infections and keeps mucus buildup down. You'll also want to limit gas-producing foods like beans or carbonated drinks, just because they can cause discomfort and make managing the pouch a bit tricky. And as for hygiene, modern pouching systems are fully waterproof. Showering and swimming are perfectly safe and, frankly, highly encouraged.
Now, we really need to talk about something critically important but often underreported, and that's intimacy. Sexual function is frequently altered by this surgery. Men might experience erectile dysfunction, and women might face vaginal dryness or altered sensation. Please know, this is completely normal post-cystectomy. Having honest, direct conversations with your partner and your care team is vital. There are excellent referral options out there, like pelvic floor therapy and sexual health specialists, who can really help you navigate this aspect of your recovery.
Section 5. Long-term survivorship, the long game. Reaching a successful long-term recovery means shifting from being just a patient to becoming an empowered survivor. So here is your long-term checklist for success. First, and this is huge, keep every single follow-up appointment. Your regular imaging and labs act as your early warning system. Consistency here turns a good surgery into a long-term win. Second, ask your provider about genetic testing and biomarker mapping of your tumor. That can actually open doors to highly personalized clinical trials down the road. And finally, connect with a support community. Sharing experiences with others who truly get it normalizes the challenges and greatly accelerates how fast you adapt.
You have survived a major life-altering surgery. You've learned the essential complex skills for your daily care. And let's face it, your body is incredibly resilient. The tools, the guidelines, and the support systems are all right there for you. So as you look forward to the days, months, and years ahead, the power is entirely in your hands. How will you take this knowledge and use it to build a deeply meaningful, vibrant, and active life? Thank you so much for joining me for this explainer. Keep learning, keep moving, and take care of yourselves out there.
So that was the cartoony version. Which did you prefer, Lori?
I actually like the first one better
Yeah,
than the cartoony one.
I thought the photorealistic was better, but there was a few things that was covered differently too that it talked about, but generally the same message because it's the same thing out there. So a lot of you folks saying you really like this stuff. I told you I was going to blow your mind. Now, if you're looking to find it, all you got to do is Google NotebookLM. It'll get you right to it because it is a Google product. Fortunately, it is free. I do pay for the pro version of Google because I use so much of it, and some of the things require certain credits and things. So your speed and number of things you can produce could vary, but I have not had any limits on using this Notebook LM at all. So it's really kind of a cool thing to utilize. I'm going to see if I can pull one other thing up here. Share my screen will allow me to do this. A window. Okay. All right. I'm not sure if you're, let's see, I got to hit share. All right. But I want this one. All right. You could tell me, Lori, are you seeing the window for Notebook LM?
Yes.
All right, good. So I just wanted to cover because I didn't really show these things, but this is everything the studio can produce. You want just an audio version, it'll do that. The slide deck we did, the video was something that we did. I have no idea what a mind map is. It'll produce reports, flashcards, a quiz, infographics, and data. And I ran a couple of these just to show you what it comes up with. So this is a post-micturition dribble management guide that I was doing for a different talk. So it produced this nice little banner thing. That's kind of cool that you could put in your office. Flashcards. Let's see what those look like. So it produced a few of these. I guess if you wanted to study. And here's the dribbling quiz. What is the primary clinical distinction between post-micturition dribble and terminal dribble? So if you're trying to get a study thing, you can go into that. I'll just pick one. Oh, see, it tells me which one was the right one. So that's kind of cool. So, all right, let me just stop sharing that and get back to our there we go. So I just wanted to show you a quick demo of the actual program itself working in live. So play with it. I encourage you to utilize it as much as you can. Just the more you do, the more you'll learn. And in the old days, you really had to know how to prompt AI to get it to do anything. Nowadays, just talk to it like it's your buddy. If you don't like what it did, tell it you didn't like that. Try something different. It's one of these things you learn by doing it. I've had a lot of people come up to me and say, wow, I really like what you do, but how did you ever learn all that stuff? Well, practice, it's just how I learned how to play the organ. I practiced every day, same thing. So I hope everybody enjoyed this. I don't see any questions. I saw a lot of great comments. Lori, do you have any questions or?
No, I think that's fantastic. I can't wait to try it.
Yeah, that's what I'm thinking a lot of people will do. All right. Well, now next week coming up on UroNurse.
Prostate cancer remains one of the most prevalent malignancies in men globally. But the clinical approach to early detection, PSA screening, and biopsy criteria varies significantly across borders. European urologic practices, frequently guided by the European Association of Urology guidelines, have paved the way for innovative screening strategies. These include risk-stratified screening, widespread utilization of pre-biopsy multiparametric MRI, and a significant clinical shift from transrectal to transperineal prostate biopsies to minimize sepsis risks. Join us on July 25th at 9 a.m. Central Time to learn more.
Yeah, I'm looking forward to that. It's Leanne Johnston, who's from Europe, is going to be talking about the difference between how they do things and how we do things here in America for prostate biopsies. Should be interesting to see some of the things that are similar and some that are different. I remember giving a talk about the post prostate biopsies here in America, and it was a group that was from England, and we were talking about how we always tell patients take a fleet enema. They said, "Oh, you Americans with your fleet enemas, you can't prep a bowel." And I'm like, I know you can't prep a bowel. I says, but we don't get as much free time as you guys get. So patients are really upset when you have to cancel them because they had stool in there, right in their rectum. So a fleet enema will often save you from having to reschedule somebody. They're like, yeah, you guys are still crazy. So it's always interesting to see what somebody else, across the pond might be thinking. So tune in for that one next week. And hey, thanks, Raj, Charlene, Diane, Tabo, all for your great compliments on liking this, and go home and try it yourself. All right, Lori, have a great rest of your weekend, and we'll see everybody next week on Euro.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.